I want to welcome you today, and I'm very excited to welcome our speaker, Dr. Sepideh Tabibian. Sepideh is a GNEM patient and a family practitioner who focuses on holistic medicine and nutrition. She served on the board of directors for NDF for many years, and she's presented to several patient groups at our symposia in the past on topics that have always been interesting and popular with our patients. So Sepideh, I'm going to let you go ahead and give your talk. I ask that everyone keep your cameras turned off and your microphones muted. Go ahead and ask any questions you like in the chat on the side there, and we will get to those after Sepideh's presentation. So thank you, Sepideh, for joining us today.
Thank you, Nancy, for that lovely introduction. Hello, everybody. Thank you for tuning in. I'm here today to talk about my journey in life, focusing special for the past 2 years. So I have served as NDF board member for over past 10 years, and I've been a patient, GNE Myopathy patient, for almost 23 years. I've had life experiences that tested my inner strength, starting from my childhood up until recent personal trauma that I had, that I'm going to talk about. And I want others to learn from this journey. And I want to show that hope is really the driving force for any stage of life, especially for GNEM patients. So for that, I'm going to start from my childhood. I was born in Iran. I was born and raised until age of 18. I had a good childhood until age of 10 when the revolution happened. I was very active as a child, and as you see on the right, I did ballet from age 7 to 14. This is a performance that I had there on the last one here. We were 7 dwarfs. So revolution happened age 10, and then unfortunately there was a 10-year war that happened in Iran, and I was there during the war, which it was included a lot of bombing, a lot of running away, and it was pretty traumatic. And especially because I was minority there, I was Jewish, it was really hard for us. So I was able to get away from that and just leave Iran at age 18, and I went to Italy, and I was there for 7.5 months, and then I came to California, to US California, and immediately I started going to right away register for college and went to continue my education. And after that I went to UCLA and then to medical school. This is a picture in medical school and with friends there. Third year of medical school is when I was diagnosed with GNE myopathy, and it was a very traumatic experience by itself. And after that, actually, when I was in medical school and residency, I did not tell anybody that I had that. And I continued to work really hard, continued to do everything, and working long hours. And as my disease was progressing, I tried to not to focus too much on it because I was so busy going through residency and everything. I finally graduated in 2002. This is actually in 1999 when I graduated from medical school on the left. But then in 2002, I also finished my residency, and I became a family practitioner. The picture on the right was when I was pregnant with my daughter, and that was during the 2nd year of residency. So that was a tough time because I was pregnant and I had to do calls, so I have to be awake for almost 30 hours. And I also was dealing with myopathy, which muscle weakness. That, however, was not the most difficult time of my life, believe it or not. In 2015, I went on a trip with my daughter to Mexico. And when I returned from Mexico, I noticed my daughter had fever for a day or two, which resolved. Then I started having diarrhea myself, and I didn't think about it much. I thought it's just like something's going to go away. Unfortunately, that was not the case, and the symptoms kept progressively getting worse and worse until I saw a gastroenterologist. And after colonoscopy, he told me that I had colitis, which is inflammation of large intestine, and it was only on the left side of my intestine. He gave me some anti-inflammatory medication pills and said, just take these and you're gonna feel better. I took them, didn't help. So being in the holistic, I'm very interested in holistic medicine and everything else. And I said, I'm just gonna explore other options to treat my colitis. So I basically did a lot of things. Took a lot of herbs, a lot of meditation, a lot of different treatments. I did a lot, and my symptoms got better and improved. But however, at this time, I was a single parent and I was working full time, and it was I have so much stress on me. So everything that I did on that side, as far as the nutrition, other modalities, the stress that I was going through was like counteract all of those. So symptoms got really worse to the point that I was bleeding every day, and it was end of November of 2000, actually November 26th of 2018, that I said I need to go see a gastroenterologist again, and I also knew that I would be hospitalized. So I went in and I saw my doctor, and he just sent me to the hospital, and this was West Hills Hospital. And over there, the doctors put me on, they did colonoscopy, and they said, well, your whole intestine's now affected. It's just really bad shape. So we're gonna put you on steroids, IV steroids, which was 5-day course of IV steroids. That didn't help. So they said, we're gonna try this medication, which is infusions, given by infusion, and it's called Remicade. And he basically said, this is your last hope. So I just went with that. They gave me the medication infusion, and then I was not ready to go back home because I was really weak at that time. So they sent me, I was sent to rehab. And this rehab, I was there for 2 days, but my blood pressure was so unstable, was so low that at midnight, basically, I checked in Cedars-Sinai Hospital, which is actually famous for IBS, problem with inflammation of intestines. So over there, I was there for 6 days. I was very unstable. My blood pressure came coming down. My red blood cell count kept coming down because I was losing so much blood. So they kept giving me blood transfusion. They kept giving me IV fluids. They kept giving me electrolytes because everything was out of control, out of balance. After 6 days, they finally stabilized me enough to send me back to the same rehab. And I was determined to stay in rehab. I said, there is no way I'm going to go back to the hospital. I'm just going to stay here until I get better, I go home. Well, unfortunately, that was not the case. I was there for 5-6 days. I guess the second day I started having fever, and the nurses there, they told me, don't worry, because your red blood cells is low. That's why you have the fever. But I knew that wasn't the case. So after 5-6 days, I just went and I saw the doctor. I saw the hospitalist that was in the hospital, the West Hills Hospital. So sure enough, he sent me back to West Hills Hospital. So I was actually in 2 different hospitals. This was the first hospital that I was checked in, so I went back to the same hospital. So the gastroenterologist came in and saw me and said, you know what, we cannot do anything for you at this hospital. You should go to Cedars-Sinai as soon as possible. So I was transferred there. And then the first day that I was there, I was surrounded by a bunch of surgeons and gastroenterologists, and you name it, internists. There were like maybe 10, 15 people around me. And they said that we have to take you and do the emergency surgery right away. And I was hesitant at the time, and they said, you know what, Sepideh, if you don't do this, you're gonna die. So we have to go right away. We have to take you in right away. I said, okay. We prayed, and they took me in, and they took my whole large intestine out, and they put a bag connected to my abdomen. So they basically attached my end of my small intestine to this bag, which is called ileostomy bag, and they connected that to my abdomen. So basically, every time I had a bowel movement, it would go through that bag, and we had to empty the bag and change it every 4 or 5 days. When I came back from the hospital, I was still intubated because I was not stable at all. So I had the breathing tube in my mouth. I was not able to talk. It was like breathing through a straw. It was very uncomfortable, and I was in ICU. At this time, they were giving me the nutrition through IV, and I was on a bunch of IV fluids and medication, you name it. So it was very sad. I was terrified looking at that bag, and because this was something I was worried about the whole time that I was dealing with it, but then like that was it. I had no more large intestines. So as I was in ICU, obviously I was going through a lot of pain. They put me on a lot of pain medication. And finally they took the tube out, they sent me to a regular room. And I was there for a few days, but then like a week after the first surgery, I started having really intense abdominal pain. It was really bloated and so much pain that I was just calling nurse every 5 minutes. Finally, the pain was so bad, they called a surgeon and he checked me and he said, you know what? You might have ruptured intestines. We have to take you in right away, but before taking you to OR operating room, we need to get you through CAT scan to see exactly what's going on. Well, the nurse could not get me through CAT scan because my blood pressure was so low and unstable that it was just so dangerous. So they pumped me up with so much IV fluids for just the blood pressure was to be stable enough for me to go through CAT scan. And during the whole thing, I had so much pain, so they kept giving me pain medication. So they finally took me to CAT scan, and they said, we see some fluids there. We don't know if there's rupture, but we have to take you in right away. So by the time I was being wheeled to OR was around 5, 6 in the morning. And the surgeon told me, have you told your family? And I said, no. So I remember seeing the nurse calling my family at that time, and it was so devastating. So I went to the OR operating room, and they took about an hour or so, came out. They found there was no rupture, thank God, but they found some fluids in there. So they just cleaned it. They sent me back for recovery. Still, I was intubated this time much longer for 5 days, and they took me to ICU again, and the whole thing happened, you know, all those medications to keep my blood pressure up and everything else, and then nutrition, IV nutrition, all of that. And then the other problem started. Basically, I started having fever and I started having infection all over my body, which was called sepsis. And that's very dangerous because people can die from it. So I dodged a bullet first time when I went to first surgery. This was the second time that I was getting close to actually not making it. So everybody was very nervous. I was in ICU. They had to keep me on 3 IV medication to keep my blood pressure up. I was on 5 different antibiotics. They didn't know exactly what bacteria it was. So they put me all broad spectrum antibiotics, which is 5. I had my electrolytes were out of balance. They kept giving me IV fluids. They kept giving me blood transfusion. They did everything possible. My white blood cell was so high, and that's because of the sepsis. So at this point, I didn't know what to do. All I did was pray and just visualizing them getting better. And they basically told my family that I was going to be in ICU for probably in a week, if not more. So I guess it was the 3-4 days into it that I have a picture of it. This is where I was in ICU on the left. So there's so many tubes and things. This is the breathing tube in there. And thank God I was on so much pain medication. I was sleeping the whole time because it's so difficult to be up. And I had so much pain. And then I guess it was the 3rd, 4th day of the ICU that my family, 2 of my family members, a friend came over, and basically they started doing praying and energy work at the bedside 3 days in a row. And by the end of that day, I felt a little bit better, and things started to turn around for better. My white blood cells started going down. My blood pressure was more stable. I started feeling a little bit better. And after, I guess, a couple of days later, they took the tube out, and you see on the right, they put oxygen on me, nasal oxygen. And then they sent me to regular floor. So things was getting better and I was very happy. However, the other problem started, which was they sent the physical therapy to work with me, but because I was in bed for 2 straight months, my body was so deconditioned, and because I have GNE myopathy, I wasn't moving at all. So when the physical therapy walked in, she tried to sit me up, tried for me to get up and sit up in bed. I couldn't. I was so dizzy, and because of all the IV fluids they gave me, I was very swollen in my arms and legs, so they were super heavy. So she couldn't get me up. She couldn't get me to sit up even. So she said, the only thing I can do is like to make your bed in the form of a chair. So at least your positions change. That's all she did. And I was very, very disappointed because I was so scared how I was going to go back to home. I wasn't able to even sit up. Before going to the hospital, I was walking with a walker and I could do certain things on my own. But at that time, I couldn't even sit up. So a week later, they sent me a different physical therapy, and I think she was the angel sent from sky because she was so encouraging. And I told her what was going on. She said, "Don't worry, we're gonna work together." So slowly she started like helping me to sit up, and every little movement improvement I made, she made a huge deal out of it. She gave me so much hope. She encouraged me. It was such a great time. For the first time I met somebody who was like giving me good news, trying to encourage me, because up to that time, all the doctors were talking about was like negative news, giving me negative news. And being a physician, I knew exactly what was going on, which was very scary. But it was the first time after 2 months that I was hearing somebody giving me encouraging words, helping me to get better. And so slowly with her help, and it was like a therapy session for me. It was just crying and she was helping me, and I was able to sit up slowly and then hold on to her and get up from the bed. And then like in a few weeks, I was able to hold on to two people and just make just a few steps, take a few steps in the hospital room. So I was very happy, and I said, and I was more stabilized at this time. So they wanted to send me to rehab. I didn't want to go to rehab I was before because the physiotherapy department was not good there. But they sent me, they said that they found finally a nursing facility because of my insurance company. There were some issues. They couldn't find me a lot of other places. So finally, I guess it was a long time. It was 10 days I was in the hospital waiting for placement. They sent me to this place. Meanwhile, when I was in the hospital, besides the physical therapy, the nurses were so scared to handle me. They were like, they didn't want to touch me. They were scared that I would fall. So if I want to sit on a chair, they had to lift me up from the bed. They use a lift to put me in chair because they were so scared. And I was so annoyed, and I was so unhappy about this because I wanted to do some movement, but they wouldn't let me. So I was very happy, excited to go to nursing home, so just use their facility for physical therapy. So finally, they actually didn't put me in chair to take me there, wheelchair. They were so scared that they put me in gurney, and they took me with ambulance to the nursing home. I was there, I got there 7 o'clock, 7 p.m. It was so depressing there. There was a room shared by 3 patients, and they were all, I was the youngest one there. They were in their 70s, 80s. Some of them, they had mental problems, they were screaming every night. But because of the physiotherapy was good, I just stayed there. And what I did, first thing in the morning, I would wake up and I asked them to take me to physical therapy department. It was the best room in the place, and it was like bright, and I wanted just to be there. So they started working with me. At first, I was on a wheelchair, and I was able to barely stand up with their help. So first couple of days, I just helping me to stand up. And then they took me to this sort of like ballet bars, both on each side. So I was holding on to that and trying to just stand up there. So slowly I was able to take a few steps there. And meanwhile, there are like one person just with wheelchair behind me in case I fall. I cannot hold my balance there to be safe. So a couple days I was able to take a few steps. Meanwhile, the whole time I was going to bed at night, I was visualizing that I'm walking, visualizing that I'm using a walker. I was visualizing that I was getting stronger. So, and I was meditating at that time. I tried to eat as healthy as possible there, even though their food was not good. And then what happened, I was slowly able to walk with those, holding those bars. And I told them, the physical therapist, that I want to use the walker this time. I just want to be able to stand up with the walker. And she said, sure. So she brought the walker there and I wasn't able to stand first. And then after a few trials, I was able to stand for maybe 20, 30 seconds. And it was like, we get dizzy in like a week. So I would just sit down after that. But I started visualizing myself and I told myself, I'm not going to let this happen. I'm just going to be able to walk. By the time I leave this place, I have to walk around the whole area, which was about 400, 500 feet. So the next day I tried and I was able to stand for a minute. And then I never forget this day. 2 days later, I was able to walk with a walker. And then I never forget looking at all the therapists, the physical therapists' jaws, they were literally dropped. And this is a picture of when I started walking, and this is in the nursing home facility. They would just put this belt on me, and they would just for safety reasons, safety issue. And I also extended my stay there for another week because I was supposed to be there for 2 weeks and I wanted additional time to work on my walking. And sure enough, by the time I was ready to be discharged, I was walking around the whole area. It was like 5 days straight. I was walking the whole 400, 500 feet. I was so happy. When I went home, I thought everything was going to be over, but problems started, and I had to adjust with new life. And I also saw my surgeon for follow-up, and I wanted to get this bag out because the bag was so uncomfortable. I had to empty it every 2-3 hours. I was not able, because of the muscle weakness that I had from GNE myopathy, I was not able to change it every 4 or 5 days. So we had to bring the nurse to change it. At this time, I was not able to take care of myself, so I had 24-hour care hired at home. I was down to 90 pounds from 115 because of what was going on. It was so hard for me to eat a lot of food, and I had to be careful how much I eat. So I went back to my surgeon for follow-up, and I said, I want this bag out. And he said, don't even think about it. With your muscle weakness, you won't be able to go to the bathroom quickly, because once we take the bag out, you probably have to go back 10, 15 times a day to the bathroom. I didn't listen to him. I said, okay, and just said bye. So I started searching, finding other surgeons. I met 2 other surgeons and they said the same thing. They were kind of scared. They said, just stay with the bag. There are a lot of people live with this bag. And I was thinking to myself, you don't know what you're talking about. Do you have a bag yourself to talk about other people? And I was so determined to get this bag out of me. So I found a surgeon that I really liked. He was so friendly and answered all my questions and willing to talk to me. And he just willing to try it and go for the surgery. He said, there's some chance that we won't be able to do it, but I'm gonna try. And in June of last year, I went for my first surgery. And this is a picture of the first day, the morning that I was going for surgery, and this is the back. I wanted to have the last picture with that, and the gray is the back, that ileostomy back. And on the right, I went for surgery. I was very scared. This was supposed to be a very big surgery. It was like, it took about 2-3 hours, and they basically, in this surgery, they connected my small intestine to basically my rectum, but I still have the bag attached because the second surgery was when they took the bag out. And every time I went through surgery, obviously I had a big, long recovery because I wasn't able to eat. I would lose weight. I was on tons of pain medication, but I was very happy because despite of what they told me that this is not going to happen, I went through the surgery, and in October of last year, I did the last part of the surgery, and they took the bag out. And I'm so happy with what happened. I mean, obviously, it was a traumatic experience, and I learned a lot from it. I learned to take care of myself. That's the #1 priority. I was spending a lot of time working and not paying attention to my body. And I know self-love is very important. And that was the biggest lesson for me. And the other one was never lose hope. I know a lot of the patients are listening. You also suffering with GNE myopathy, and you know how hard it is to just deal with that on a daily basis, and have another thing happening, another chronic issue is really tough to deal with. But I never lost hope. And even though the surgeon kept telling me, well, you almost lost your life 2 times, I'm just gonna move forward, and I don't want to listen to negativity. And that's something kept me going all these years, and especially past 2 years. This is the picture, the latest picture. It was in Mother's Day of this year, was May. And this is my daughter. And I also want to talk to about this before talking about my daughter, when she's doing with NDF. I'm also in the process of writing a self-help book. And this is for people who have chronic issue, and teaches them how to live a better, healthier, and happier life. And hopefully would come out in maybe in 2-3 months. And then I'm planning maybe hopefully next year a patient symposium to talk about it. And whoever buys the book, I want to give some proceeding to for NDF. Some of the money would go for NDF research. This is my daughter Ariella, and she is also running a subdivision of NDF called NDF United Youth, which is a support group for children of patients with GNE myopathy or similar genetic disease. And if you know somebody who's interested in that, then you can find it on the website, NDF website, or Facebook. And I think it's very important for children of patients with chronic issues and disability to learn to cope, and how to cope with it, and to speak up about it. So the key takeaway is basically the qualities necessary for overcoming any challenges. And I think the self-improvement and everything, the foundation, everything that I did in the past was the foundation on overcoming my challenges. And life challenges are always opportunity for growth. You can look at it both ways. Glass is half empty or half full, and I always choose the second one. And I try not to look back and live in the past, and just focus in present time and hope for the best for future. And this was like a huge wake-up call for me, and I learned so much about it. And as I said, self-care and self-help, love are very essential. And you learn how to reach your own inner strength. And hopefully what you get out of this is just never lose hope, and always remember that you always have other options to look into it. Just think about positive outcome, and be surrounded with positive people, and life is going to be so much more beautiful. Okay. So this was about my talk, and if you have any questions.
Thank you. Thank you, Sepideh. That was such an inspirational story, really, for people, regardless of GNE myopathy or not. Just the lesson in self-advocating and in taking care of ourselves. And I love that you didn't take no for an answer from your surgeons. I think that, you know, we can all learn from that, from your strength. And I know that I can speak on behalf of everyone listening that we thank you for, you know, the bravery and the honesty that you showed us today. I think it goes a long way for everyone. We do have a few questions, so I want to go ahead and get to them so that you discuss the things that people who have been listening are asking. So Sharon asked, what helped you in the depth of darkness and hopelessness not to quit?
Think about future, like what I was going to do, and believe it or not, I was thinking about doing this talk and helping other people at that time. And when it comes to the bottom, it was just connecting myself with a higher source. You could call it God, you could call it universe, and doing skills that I knew, which was meditation and pray at that time, because there was nothing else I could do at that time. So it was pray, visualization, positive visualization, think about the future, what I'm going to do, being there for my family, and I'm going to help other people. And that was like a big motivating factor for me to help other people.
Wow, it's amazing that you could have the presence of mind to think that way at a moment like that. That sort of answers Mangesh's question. He was asking if you found meditation helpful in staying positive and strong, which
Oh, for
obviously.
sure, for sure. I mean, I learned meditation age 16. However, I wasn't doing it all the time, but when I came throughout the whole ordeal and when I came home, that's what saved me actually, because I was super depressed when I came home. And doing meditation helped me so much, helped me to get out of it and then just to bounce back, to just like recover much faster. So it's like a big key, not just only when you have trauma, just in general. To me, it's a big key because a lot of issues we have is just the way we think. It's our thought process that just give us certain feeling. And if we kind of quiet our mind on daily basis, it's just going to help a lot. So I definitely encourage people to do any type of meditation. It doesn't have to be certain type on a daily basis.
Yeah, Mangesh was asking for any specific tips about that. And I know that we have talked about you're doing another talk someday to cover things about, things that you've covered in the past with patients about meditation and health and nutrition. And I know you've talked about essential oils with patients in the past. So that's something that we can certainly address in another talk. Is there any specific tip that you would offer just as a sort of basic starting ground for people?
For meditation or for everything else?
For meditation, he was asking.
Yeah, so what you can do, you can just find a quiet place in your house and then just sit down and make sure you're comfortable and there's no distraction. Then just close your eyes and then either focus on your breathing, inhale and exhale, or you can repeat a mantra. Mantra is a word that doesn't have any meaning. The universal mantra is Om. So you can just repeat that in your head, not out loud, and then just focus on it. And then it's very normal for the thought process to come and the chatter in your head, and that's okay. Once you become aware of it, go back to the mantra, or go back focusing on your breathing. You can start with 5 minutes a day, and then just slowly increase it to like 20 minutes a day. And it's best if you do it twice a day. But if you can't do it, that's fine. Even once a day is fine. And then you just give it time. You should be patient. And in the beginning, you might not even be able to focus, and that's okay. But you're still getting the benefit of it. So don't doubt it. Just continue with it. And I definitely want to have another talk if patients want to do it about like more like depth into the practice that I did before, during, and after going through this trauma, which helped me a lot. So it's not just one thing, but it's a series of things. And these are all going to
Right.
be.
I think there's definitely interest in that. We would love to have you back to dive deeper into that. I know the patients would love to hear from you about that. And really not just patients. I mean, I would learn a ton from you as well. No question. Lale actually asked, given that comorbidity, meaning two conditions at one time, are a reality for anyone, but especially for people with GNEM, don't you think it's important to see surgeons and doctors that are also familiar with GNEM? And if so, as a doctor, how do you think we can get on the radar for medical students so that more doctors are familiar with this condition?
Yes. I was actually very upset about that because I was just telling my friend, one of the doctor was saying me was a nephrologist because I had electrolytes imbalance. So they just called in a nephrologist, and he would walk me when I was in Cedars-Sinai every night at 10 o'clock at night and just look at me and just look at my legs and say, "Oh my God, you're so deconditioned. Oh my God." He was so negative, and I was so mad and angry at him. And just And a lot of people, and the other thing that was really upsetting was a lot of nurses they were very scared to handle me. Even though when I was able to walk a little bit, they would not touch me. Even the physical therapist came, one of the physical therapists in one of the surgeries that I had, he came and he tested my muscles when I was sitting down. And then he said, just let's walk. And he was so scared, and he was so scared I was falling. And I was just reassuring him that I'm not going to fall. And he said, I cannot believe you can walk. So they're very uneducated about this. And I think ways we could do is maybe send them some information about GNE myopathy, maybe send some of our young group to there to just educate them, or have maybe a Zoom Zoom meeting to talk about it. I'd be willing to talk to them because I suffered a lot just because of that. And
Right.
it was very uncomfortable, and then they wouldn't listen to me. Like, it was just like they wouldn't listen to me, even though I was a physician. They didn't care, and that was very, very upsetting because that kind of actually delayed the whole thing. Even though when I was at Cedars-Sinai, there was a great rehab facility close by that was perfect for me, and they would just do physical therapy 3 hours a day. But when I was laying down in bed, I was not able to use my arms much, and because I was deconditioned, I wasn't able to feed myself that I would get help. So this liaison from that place would come and ask the nurses how I was doing, and she would specifically ask if I was able to feed myself, and they would say not yet, no. So based on that itself, she refused to accept me there. I didn't know
Yeah.
about that. The last day she came and said, well, you cannot feed yourself, so you're not eligible for that place. Even though that place are like 80-year-olds with all different stroke and other conditions there. And I was really mad and angry. That delayed
Right.
my whole process for 2 weeks because of that.
Right. And the good news, the well, a piece of good news we have about that is that we're in the process of getting together a GNEM clinic. It'll be based at UC Irvine for the first time. We're going to do a beta testing there and hope to open it in different parts of the country and ultimately different parts of the world, where GNEM patients will be able to spend a day seeing specialists in different specialties, neurologists, nutritionists, physical therapists, occupational therapists, but all who have a familiarity with GNEM. It seems like there's such a lacking in experience and in knowledge of this disease within different specialties. We want to be able to provide that for patients. And given the situation with COVID right now, we're going to be doing that with giving people the opportunity to do it with telehealth as well as in-person visits. So hopefully we're going to be able to soon provide opportunities for patients to see doctors who, while they may be specialists in different fields, do have a familiarity with the disease. I think we need more of that, obviously, as evidenced by your experience. I was wondering when you said that people were afraid to touch you, if that was based on your underlying condition of GNEM.
Yes,
So that
yeah,
sounds like,
it was because of GNEM, and they were basically afraid of a lawsuit if I fall.
right.
They
So
were like,
Tara, oh, sorry, go ahead.
they were refusing to do anything with me as far as movement.
Yeah. Because you needed more help. It doesn't make any sense, really.
Yes.
It just stems from a lack of knowledge, and so we need to make sure that we're able to educate more people, and while we're doing that, provide opportunities for patients to see doctors who do know about the disease, so that you are treated the way you need to be treated by different specialists. Totally
Yes.
agree, and that is something that we are working very hard to get started as soon as possible. We're actually working on it at UC Irvine and just working through some sort of bureaucratic and financial aspects, but it's really in the works. So we hope to be able to make some more announcements about that soon. Tara wanted me to tell you that, lost my place here. She just said, you're so courageous and resilient, that she had a similar procedure last year at Stanford, and that she agrees with you about the power of visualization. She lived with the bag for 6 months and had the takedown. She said she still has some minor effects related to the surgery, and she wonders if this may be a condition that may need to be addressed with GNEM patients, given that both of you have had similar experiences.
For my I think for me, I think it was one was the trip to Mexico. I don't know what I got from that trip. So that started the whole thing. And also the fact that I was under a lot of stress, meaning being a single parent, working full time, taking care of the household by myself and dealing with GNE myopathy. At that time, I didn't have caregivers. So it was really tough. And I guess the combination, that's what happened to me. And I don't know if there is a direct relationship with GNE myopathy and GI symptoms or gastrointestinal symptoms, but it's definitely a lot more difficult when you have two chronic conditions than one chronic condition. And
Right.
I hope that's not the case. I hope, and I know a lot of people don't have any issues with their GI system, but stress is a culprit for all of this. So stress is not good. And that's something I learned that I need to take care of myself. So self-care and self-love are very essential. It doesn't matter
Right.
because you need to come first. So that's something I learned from. That was the biggest lesson. So now, and I don't feel bad if I'm not working anymore, and I don't feel bad about it. I need to take care of myself.
Smart, because taking care of yourself is really helping to take care of anybody around you, right?
Exactly. Yes.
Think I need to learn that too. Sharon wanted to say that she really applauds your strength and resiliency, that you're a symbol of hope and love, and she thanks you so much for being so authentic, brave, and resilient.
Thank you, Sharon.
Lale asked if you recommend psychological support in any formal way for patients or people in general.
100%. 100%. 100%. Like that's something I've been having therapy and different type of um, modalities that help me psychologically. So that's like number one up there.
Yeah. So we're also part of, actually, I should have said earlier, part of the clinic that we're starting is going to include some emotional wellness. We have an emotional wellness director, Carol Gelbard, who I think you've probably met at some
Yes,
of the
yes, I know.
symposiums. She's offering personal sessions with patients of GNEM to sort of do a needs assessment, not necessarily specific counseling, but to help people find the counseling and the tools that they need in order to help them with their emotional wellness and psychological help that they might need in conjunction with battling a rare disease. So I think that's another thing that would really be helpful for people, and we're hoping as part of our patient advocacy program people will take advantage of.
Yeah,
Um,
because emotion well-being is really essential in a person's health. So if you're healthy body-wise, like even people who don't have GNE myopathy, and like you're not taking care of your psychological health, it's not like a healthy lifestyle. So that's very, very special with people with chronic issues and disabilities. So
Right. So do you think that you could lead a meditation workshop, or is that sort of a contradictory idea, a workshop
no,
in
no,
med?
no, 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 I can do that. That's fine.
Yeah, because some of us, Lolly was saying, and I agree, some of us have trouble quieting our minds and learning how to get to that place so that
It's
meditation
just practice. It's practice, and a lot of people, I myself too, a lot of times I have chatter, but this is basically what's helping you with chatter. Just because you don't have a good meditation session doesn't mean it's not effective. It still affects you. So just do it no matter what. And I'm be more than happy to like just um, run like a meditation session, talk about it more. And they've been doing a lot of scientific research on that with people who do meditations. They live longer, they have low incidence of high blood pressure, and just overall well-being, and blood sugar is more control with meditation, a lot of other things. So it's really good for anybody.
yeah.
Um,
You mentioned something about energy work at your hospital bed. You said there that you did some prayer and energy work. What did you mean by energy work?
well, people who work on me, they're energy healers, and I'm also into energy healing. So they basically at the bed, like in the hospital when I was in ICU, and they're just praying and putting their hands on me. I had 6 hands on me at the same time. They're praying and doing energy on me. And because I'm into all of that, it really worked for me. It really helped me a lot. Because that was a turning point. After the third night that they did that, they would come in every night. I saw a big difference, like a turning point, because by that time everything was going down, like everything was getting worse.
Mhm.
And that's what started to change it.
Wow. And the meditation, is that something that you ever do private sessions for? Is that something that you
Yes,
do?
yes, I can do private sessions, yes.
Okay, so we'll make sure that everyone knows who is on the call, how to get a hold of you if they don't already. And they'll be able to watch and anyone who watches the recording, will make sure we put that there too. So I think we've made it through the questions, but I did want to just, while we have you, give people the opportunity to hear from you what you found personally to be helpful in your fight specifically against GNEM. If you have any practical tips to share for patients who are, definitely so inspired by you and your story, is there anything just before we close up that you might be able to say to patients who are listening or patients who watch the recording of this in the future that
Yes,
you found to be helpful to you?
sure. In general, is working on body, mind, and soul. So it means body, meaning you need to movement, any type of movement that you can do. Even if you can't do it yourself, you just, if it's possible, just get help to do movement. For me, it's been yoga and other. Right now, I walk outside for like a half a block as much as I can. So any type of movement is important in the body part, and also nutrition is very important. Mind is really important part, which is like, because the way you think is makes you the way you feel, and the way you feel changes your reality. So meditation would be very helpful, practical. Watching positive videos, watching comedy, anything, especially these during the COVID, every news is so negative, everything is so, it's fear everywhere. So for me, I just get away from that and just submerge myself in just listening to motivating talk, talking to positive friends, and anything that is positive, and focusing on future, and that really helps me. So, and then spirit is doing spiritual practice for everybody is different, and these are, as I said, all of this is going to be in my book. Some people like to go to church every week. Some people like to meditate. Some people like to do different things, and for everybody is different. But having a ritual, like you do it every week or every month, and that's really helpful. So
That's
this is in broad spectrum. Obviously, it's very details into it, but that's what it is. That has helped me personally, and still continue to do help me.
I think what I learned most today is that we need more of you. So we're going to have to figure out ways to have you come back and talk to all of us about a lot of these things that you've touched on today. It was important that we hear your story, and I thank you so much for being so honest with all of us. And but I do think that you've got a lot of knowledge in there that we need to take advantage of for the entire community. So on behalf of everyone, I really do want to thank you for sharing so much of yourself with us today. So with that, Sepideh, I just want to thank you so much for taking your
Thank you
time.
so
I
much,
know it takes
Nancy, for
to
inviting me.
do the presentation and a lot of energy to make a presentation like this and to share so much of yourself. And I want to thank everyone for giving us this part of your day, and wish you all a good weekend. And we look forward to seeing you back here again next week.